So we've heard a little bit about the reality and about your clinics and the coalition. You have this captive audience. What can we do to help the mission of the coalition and the work of each of your agencies? So what are some practical things that those of us here could do to help you?
I think an important first step is awareness and education. So being aware of the situation that many people in this country face in regards to healthcare. And I mean, this is a small group, but if each of you talks to 2 or 3 people about what you heard tonight, then we're starting to make a difference more and more. Learning more about the social determinants of health that we talked a little bit about tonight, so other factors that are affecting health that are not necessarily healthcare, and allowing this knowledge to affect your political decisions. So for example, supporting candidates that are committed to a strong safety net, or candidates that want to create more parks or spaces where people can exercise, put more grocery stores in neighborhoods that don't have access to healthy food, that kind of thing. One way you can help the coalition directly is donations to our general programs, if anybody is able to donate. Like I explained with the language interpretation program, we rely heavily on funding, and our programs can't hold up if we don't have that funding, so it's very, very important. And then finally, we have a sign-up sheet out there, so if anyone wants to sign up for our e-newsletter or friend us on Facebook, you can stay involved and hear more about advocacy opportunities or other ways to help out.
When you hear your legislature saying call in and support public health, that's a real help if you can do that. Our lobbyists are at the Capitol, and they want to hear from people in the community, and so that's very helpful to help support the FQHCs, the Federally Qualified Health Centers. Also, I'd like to say that please don't have preconceived ideas about FQHCs, because people are people. They do deserve to be treated with dignity and respect. Rosewood is a family practice. We have excellent staff from the front office to the back office, great medical assistants, great doctors, great mid-levels, and we have a wonderful administrator. Her name is Kate Messina. You can get in contact with her regarding how you can support Rosewood. I did leave a couple of flyers, and I think Pam or Carol has those. But just please don't have preconceived ideas about public health, because we are the safety net for the community.
There's a lot of ways you can help. I realize college students aren't the best people to hit up for money, so but there's some faculty here. You guys, of course, donations are always great, but not just financial. But I was glad to hear about the personal care drive. That's a huge help. There are a lot of people who don't have access to just basic personal care items. We have a lot of folks who, when they come in off the streets, we can get them housing, and then we sort of go into our supply closets and get them combs and toothbrushes and toothpaste and shampoo and soap and all that stuff. We rely on donations for those items. Socks are huge, especially in the rainy season here. If you're living on the streets, it's next to impossible to keep your feet dry, and trying to live with wet feet is really not healthy. Leads to a lot of problems that way. Volunteering your time. If you have time and interest in volunteering, there's a lot of stuff that you can do. You can volunteer at Central City Concern. You can contact our main office. We have a volunteer coordinator. There's all of our organizations have, I think, volunteer opportunities of one form or another. go into healthcare professions. I don't know if you guys have already declared your majors yet or not, but we need nurses. I know nursing school is hard to get into, but those of you with the higher GPAs, go into nursing school. Those of you with the lower GPAs, work on getting them up. I'm a nurse. Before I went to the dark side and became an administrator, I worked clinically for years. But I mean, we need doctors and naturopaths and midwives, and with the changing healthcare environment, those of you who have been following health transformation or healthcare reform in Oregon, there's more and more kind of variety, I think, in what we're going to see in the healthcare delivery field. There's going to be more what they're referring to as community health workers. We need people to go out where people live and help people to either figure out how to live a little more healthy, how to manage the chronic medical conditions that they've got, and also how to navigate the healthcare system. It's not easy to navigate. I mean, as a healthcare professional, and my wife is also a nurse, and she had a lot of healthcare issues a couple of years ago, and we had the hardest time negotiating all the specialists and the hospitals and the everything you have to go through. And we realized that as educated and as experienced as we are with the system, if it's that hard for us, I can imagine what some other people go through. And so there's going to be jobs coming for people to just help other people navigate the system. There's just a lot of opportunities out there, and so sort of in whatever way you're able or willing to give, just kind of reach out and ask for what those opportunities are, and you'll find plenty of things that you can do. And vote. Please vote. I don't know if I left you anything.
A little bit. Well, yeah, so, give where you can, volunteer where you can, educate yourself, keep yourself educated about what's going on, support healthcare reform. The system is broken. The system is broken. Corporations are not going to take care of the neediest amongst us. Government is going to take care of the neediest amongst us, and we really have to have healthcare reform to make sure that happens. In Oregon, support naturopathic physicians being part of the solution. Naturopathic physicians are mid-level providers. They're not going to be cardiac thoracic surgeons. They're not going to be neurosurgeons. They're general family practice doctors. And the more we can be part of the solution, we can help decrease that primary care shortage we have here in this state. We need to get naturopathic physicians into the reimbursement fund so that they can be sustainable members of healthcare reform and can get out there and be able to afford to teach people how to eat better, how to cook, how to shop, how to do these things, to be advocates in neighborhoods where there aren't grocery stores. It's when you get around Portland and you find neighborhoods where there really literally aren't grocery stores. There is not fresh food available to people without taking public transportation, sometimes 1 or 2 bus lines to get to buy broccoli. It's kind of mind-boggling when you get out there and get into the communities. So, advocate for those kinds of things. Vote for people who are going to make those kinds of policy changes and make those kinds of developmental decisions for us here in Portland.
I have another one to add, which is please don't give money to panhandlers. When there are a lot of homeless people on the street and a lot of people asking for money, and it's hard to tell who's telling the truth, who's not, in terms of the pitches that they'll give you. But a lot of the people who are collecting money on the street are using that for drugs and alcohol, and it's not a sustainable solution, panhandling, and it's a hard thing to do to not give when you see someone in need, but there are much better places that you can put that money to use. And I'm not saying don't look people in the eye. That's another thing, is talk to people. Even if you don't have anything you can personally do to give them money or whatever, but you can talk to them and you can find out a little bit about what their story is. You can make sure they realize that they're seen, and you can, if you know of some resources that you can steer them to, you can help them to do that. But it's much better to engage people that way than to just give money that can often just end up sustaining some very unhealthy habits and a life on the street.